Is it safe to trip while on antidepressants? And could it actually make that trip less effective? So, science actually recently answered this question, but potentially not for the reason why you think. Now, for those of you not in the drug world, psychedelics are experiencing what we'll call a renaissance. So there's this revival of doing research on them for a variety of different things like PTSD and anxiety and things like depression. And we also know that a lot of people are using antidepressants. Like we're talking about like 6 to 10% of people, depending on the country that you're in. Now, let me just point this out to kind of directly counteract what RFK Jr. is saying. Antidepressants are incredibly beneficial for a large group of people. Now, do they have their problems? Yes. Does that mean that we should take them away and we should stop prescribing them? No. There are a huge group of people out there who need things like antidepressants. This is true for things like opioids as well, and also things like ADHD medications. So yeah, there are lots of people using them, but there are lots of people using them for valid reasons. I'll just get off my soapbox now. But so we see a lot of people are trying out psychedelics, and we also see a lot of people are using antidepressants. So people are curious about like the interaction between the two, and rightfully so, because what we see is that antidepressants increase serotonin. And you know what else increases serotonin? Yeah, the psychedelics. So people are worried about creating something known as serotonin syndrome, which is where you take too much serotonin basically, and you can get nausea, you can get vomiting, you can get things like tremors, and you can even get death with it. So now that things like psychedelics are undergoing this kind of revival, now that we're actually starting to use them a lot more in research, scientists were like, okay, but how do we deal with this problem of people that we're trying to test this drug for, like see if it helps with depression? The majority of those patients are on antidepressants. So do we just make them stop taking their antidepressants? Do we just like keep using them and like hope that it doesn't cause serotonin syndrome? What do we do? Now, in the past, what scientists have done is basically said like, okay, you need to stop taking your antidepressant 2 weeks before you go in for like a clinical trial. But here's the thing, if you've never gone through antidepressant withdrawal, yeah, it's terrible. It is not a pleasurable experience. And so you are forcing people to have to make the decision of like, is it worth it to be part of this study? Is it worth it to quit my antidepressants? Like I have to go through withdrawal, and in general, quitting antidepressants is not actually recommended. It's supposed to be tapering off of them because we see that like, stopping your antidepressants is linked to an increase in remission to the disorder. So you're way more likely to actually have kind of a relapse to depression once you stop your antidepressants. Scientists were specifically interested about kind of like 3 major things related to this question about antidepressants with psychedelics. Like first, is it unsafe? Like, are we just causing serotonin syndrome? We should probably not do that. Number 2 is, do the antidepressants actually change the efficacy of things like the acid for PTSD, for example? Like, will it actually change the outcome of the results? And number 3, do antidepressants just change the subjective effects of the drug? So even if like they help with depression later on, is your trip different if you're on antidepressants? So a recent review looked at all of these 3 questions by looking at like all of the research that's been done on it. And I find it incredibly interesting how they actually framed this question. So instead of framing the question of like, hey, let's make it safer for people to just kind of use drugs, let's make sure that they're not like getting serotonin syndrome if they're using these drugs recreationally. Yeah, they didn't ask that question at all. Because honestly, you're never going to get research funding for that question. Like, yes, we want people to use drugs safer, but the government is not going to give money to help people use illegal drugs. So instead, the research question here is, if we are making research protocols for things like testing to see if acid works for depression, do we have to make them quit antidepressants? Like, that is the way this is framed to kind of get around the weird illegal drug question. So now that you've got the background that's important for understanding this question, what did they actually find? So first, they found that it was relatively rare that there was actually serotonin syndrome when you combined antidepressants with things like psychedelics. And in fact, there's really kind of only one case that they found in which that person was taking ayahuasca, which makes sense because ayahuasca is not just DMT. So DMT increases levels of serotonin in your brain. Ayahuasca does that, but in order to get the DMT to have its effects, it also has MAOIs in it. And so that also increases the level of serotonin in your brain. So what you're basically doing is you kind of have like a 2-hit with that one drug. Whereas the other drugs, so like DMT alone versus acid versus things like shrooms, like those did not seem problematic with antidepressants. Like in terms of the major side effects, it was basically headaches, nausea, and an increased blood pressure. Now, some studies actually suggested that blood pressure was decreased with the combination versus placebo. So it could be that they might actually be safer together, but we don't know that. And I don't like to say that things are safer together if we don't have the evidence to support that. So I will just say that there are some studies that suggest that. Do not let me catch you saying that, like, oh yeah, I saw this TikTok where the neuroscientist said that hallucinogens are actually better if you're on antidepressants. Don't do that. Now, how effective is like the treatment then in this case? So like how effective are antidepressants plus acid for things like depression? And what they found is that in most cases, about as effective. And there were some studies that suggest that it's more effective. What they saw was that there were problems when people quit their antidepressants before they started things like psilocybin. So that's where you actually saw the worst effects. So maybe this treatment protocol that we've been using for years, yeah, maybe it's like the worst case scenario for people. And then there was this case of this one person who ended up with serotonin syndrome. So remember me saying that, like, oh yeah, there's a person who took ayahuasca and ended up with serotonin syndrome? Yeah, that was him. And he said that, like, yeah, even though I got serotonin syndrome, totally worth it. Like, I had cheated on my wife, and after getting serotonin syndrome from trying these two things together, like, we reconciled and it was fantastic. That is all paraphrasing. Now for the last question. Do antidepressants actually reduce the trip that you're getting from any of those drugs? And in this case, we have kind of no idea. So let me kind of tell you what we found. Yeah, we've had 16 studies, a lot of them kind of like the older literature, that basically says that, yeah, antidepressants made the trip less effective. So the subjective effects of things like acid or DMT or shrooms, that was reduced if somebody was on antidepressants. 8 studies said that they did nothing together, so antidepressants did not reduce the effects. 4 studies said that antidepressants actually increased the effects of the psychedelics. And then there is one study in which the participants were like, I don't know. And that is kind of the theme of this last part. We don't know. We have absolutely no idea. And it's probably related to like a variety of things. Like when you are doing these studies, there are so many different ways that you're kind of changing the setting. So some of these studies are done in a clinic. Some of these studies are just like self-report questionnaires at home. Some of these are like chronic studies. Some of these are only one time only. And so that probably changes things. But as of right now, we have absolutely no idea if antidepressants actually change the trip, like the subjective experience of taking these other drugs. So it seems like we might have just been doing this wrong the entire time. Like we might have been overly cautious as scientists, and this might have led to some potential issues with people who are actually trying to participate in these studies.